Autism, also known as Autism Spectrum Disorder, or ASD, is a developmental disability which can cause significant behavioral, communication, and social challenges. According to the Centers for Disease Control, autism affects an estimated 1 in 54 children in the United States today. During the month of April, we recognize autism awareness, and so, in this video, we are going to learn more about autism and those who are diagnosed with it. Autism, or ASD, is a spectrum disorder. People diagnosed with autism can range from high to low functioning. Those who are higher functioning may be able to live relatively typical lives with minimal issues learning, thinking, interacting, or communicating. Those who are lower functioning may be confronted with significant challenges and require plenty of help in their daily lives. ASD is an umbrella term, which means it includes several conditions which were once diagnosed separately. Autistic disorder, Asperger's syndrome, and pervasive developmental disorder not otherwise specified, PDD-NOS, are all included under the ASD umbrella. Autism occurs in all racial, ethnic, and socioeconomic groups, but it is 4 times more common among boys than girls. The causes of autism are mostly unknown. However, in recent decades, we have learned that there are likely many causes. A combination of certain environmental, biologic, and genetic factors may increase a child's likelihood of having the condition. Studies show that autism tends to run in families, and changes in certain genes increase a child's risk of developing autism. Some people have had concerns that autism might be linked to vaccines children receive, but studies have shown that there is no link between receiving vaccines and developing autism. People diagnosed with autism often have communication, emotional, and social skill deficits. These are not the only indicators of autism, though. Many people with autism have different ways of learning, focusing, and processing. It is also common for people with autism to prefer predictable schedules, repeat behaviors or tics, and to perform habits within their daily lives. Some common signs or symptoms listed by the National Institute of Mental Health are tending not to look at or listen to people, preferring to be alone, rarely sharing enjoyment of objects or activities by pointing or showing things to others, failing to, or being slow to, respond to someone calling their name or to other verbal attempts to gain attention, having difficulties with the back and forth of conversation, often talking at length about a favorite subject without noticing that others are not interested or without giving others a chance to respond, having facial expressions, movements, and gestures that do not match what is being said, having an unusual tone of voice that may sound sing-song or flat and robot-like, having trouble understanding another person's point of view, or being unable to predict or understand other people's actions, repeating certain behaviors or having unusual behaviors, for example, repeating words or phrases, having an interest in certain topics, such as numbers, details, or facts, having overly focused interests, such as with moving objects or part of objects, getting upset by slight changes in a routine, being more or less sensitive than other people to sensory input such as light, noise, clothing, or temperature. In addition to these challenges, people with autism may experience some strengths, including being able to learn things in detail and remember information for long periods of time, being strong visual and auditory learners, and excelling in math, science, music, or art. Because autism is a spectrum disorder, each person with the condition will display different signs and symptoms. It is likely a person with autism will display most, but not all of the signs just mentioned. Diagnosing autism can occur at any age, but as a developmental disorder, it is generally diagnosed in the first 3 years of life. There is not a direct method to diagnose autism, as the condition is wide-ranging and complex. Often, the diagnosis process requires many steps and the ruling out of other conditions. Usually, by the ages of 2 or 3, a diagnosis can be given. At this point, a medical doctor would have conducted a series of screenings or evaluations noting any developmental, behavioral, emotional, and sensorial delays or irregularities. If the parent or the doctor have cause for concern, a larger team of medical professionals, including a developmental pediatrician, a psychologist, a neuropsychologist, and a speech-language pathologist, will be assembled for additional assessments of cognitive levels, language abilities, and age-appropriate skills needed to complete daily activities. There is no cure for autism, but through a combination of therapies and medications, it can be treated and managed. The best combination of therapies and medications will depend on the child's needs, but because each person with autism is different, there is not one solution. A medical doctor and psychiatrist will be helpful in prescribing the necessary management practices. Therapies tend to focus on improving speech, motor skills, social and communication abilities, and other life skills. Medications are often used to treat symptoms common with autism, including irritability, aggression, repetitive behavior, hyperactivities, attention issues, and anxiety and depression. Once the diagnosis is given, treatment should commence immediately. Studies show early intervention can improve a child's development. Autism, or ASD, is an umbrella term which includes a spectrum of developmental conditions. Each person diagnosed with autism is different. While some people may live relatively typical lives with minor challenges, other people with autism may require assistance with daily activities for their entire lifetime. The puzzle pattern often used to symbolize autism depicts the complexity of the entire autism spectrum. The variation in colors and shapes represents the diverse impact autism has on people diagnosed with the condition and their families. The brightness of the colors signals hope that we will learn more about autism, and in turn, those with autism may have access to resources so they may live fulfilling lives. This video is brought to you by PATH, Parent-to-Parent Family Voices of Connecticut. We would like to credit the Center for Disease Control and the National Institute of Mental Health for the information shared in this video. We would also like to credit Autism Society for the beautiful description of the autism ribbon. If you'd like to stay in the loop, follow PATH, Parent-to-Parent Family Voices of Connecticut on Facebook, where you'll get updates on future episodes and other programs. Thank you.